My name is Martha Raymond, and I'm so pleased to be here today with Ellie as we are going to be chatting a little bit about the process of enrolling in a clinical trial. Um, Ellie is an amazing advocate and really an ambassador for clinical trials. She's currently enrolled in a clinical trial and was actually the first patient to be enrolled in this trial in the United States. Ellie, welcome. And we could start with, if you just wanted to share, a little bit of your story.
I'll start by saying I had always considered myself one of the healthiest people I knew. Apart from never being too big on exercise, I'd always maintained a healthy weight and was a never smoker and a very light social drinker. I'd always prided myself on trying to eat healthy foods, at least as well as I knew how to. I started having this weird mucusy discharge when I went to the bathroom. And I had recently started taking some cod liver oil supplements. So I thought maybe that's what it's from. But I noticed it was unusual, and I went ahead and contacted my primary doctor about it and also let her know that I'd been experiencing constipation, which was unusual for me. She said that I was welcome to go see a GI specialist at any time, and she would be happy to make the referral. But I first decided to just see her and see, what suggestions she might have. So she suggested some dietary changes. But then when I went for my follow-up saying that my symptoms hadn't resolved, she wasn't surprised because I hadn't actually been able to implement those changes that she'd recommended. So she sent me home with the same recommendations. I was working in an office full-time, and every now and then, if I, went to the bathroom at work, there would be dark red blood on the stool. I remember it looking like red velvet because it had almost a fuzzy appearance in the water. And then one time at home, I kind of felt the urge to push or strain before it seemed like I should be. And so that was a new symptom. So at that point, I went back and looked at how long had it been since I had first reached out to my doctor, with that very initial symptom, and realized that over 8 months had passed since that time. So I went ahead and took her up on her offer to be referred to a specialist at that point. She asked if I had any family history of colorectal cancer, and I said no. In hindsight, now I know that my dad had actually told me about 10 or 15 years prior that he had had some precancerous polyps removed, but I didn't recall that at the time. So I just told her I had one aunt who had been diagnosed around age 40 with breast cancer, but that was it. So for that reason, we opted to have her do a flex sig versus the full colonoscopy. I was 36 years old at the time. So I went there not knowing I was going to be sedated and would need a ride home. And I had to call my husband to tell him that. And when I woke up from the anesthesia, the specialist somberly told us that she had found a tumor that looked like it had been there a long time. My husband's sister was a former ER nurse and said that we should go to Siteman Cancer Center, being in the St. Louis area. So I scheduled an appointment with a colorectal surgeon there. He ordered scans to confirm what stage I was, that the cancer had spread to my liver and both lungs. I didn't want to do chemo. All I had ever heard were horror stories about it, and I had always smugly claimed that I wouldn't do it. Thankfully, my husband knew better, although convincing me was no easy task, but he wouldn't let me give up so easily. I never could have done it without his loving support, and I largely credit him now with my life. We didn't know what to expect. We knew that there was a very real possibility I wasn't going to be around much longer. I began treatment a month after diagnosis. There were good weeks and bad weeks, and we learned to live life in that way. I called it life magnified because the bad times were much worse than we had ever experienced. But the good times were also so much better than they had been before. We had a newfound appreciation of life, and we made sure to take full advantage of all the good stuff. My oncologist at Siteman encouraged us to get a second opinion from Mayo Clinic, but we asked for a referral to Memorial Sloan Kettering instead, because traveling to New York City sounded more appealing, and it also seemed more feasible for us. So he referred me to Dr. Nancy Kemeny. She is world renowned, and for good reason. And just when it seemed like our options were running out, she asked me to come in and referred us to Dr. John Strickler at Duke, who was heading up the Mountaineer clinical trial for colorectal cancer patients whose cancer exhibited a strong HER2 amplification. She said, he's the guy you need to see. And back at Siteman, my oncologist, Dr. Benjamin Tan, had ordered biomarker testing, as he routinely did, and mine had shown that I was HER2 positive. So that's how I found out about the trial. When we were at Dr. Kemeny's office, after she had asked me to come back in, we were in her office for all of about 5 minutes. She had asked me to bring the documentation showing that I had the HER2 amplification. And so she had that on the desk in front of her, and she, said, so you've got this HER2 amplification. And I said, yes. And, she said, I'm going to have you meet with Dr. John Strickler at Duke. He's heading up a trial that, I think would be perfect for you. And so, so she said, I'm going to have you go back out to my waiting room, and you'll be hearing from his office. And we had planned on heading back home to St. Louis the next day. But when we told her that, she said, oh, good. So then you can just go there instead to North Carolina, to Duke in North Carolina. And that's what we did. We were at a point where we were feeling like our options were running out, because I had failed first line, second line, and third line treatment. And actually, when we were meeting with Dr. Tan at Siteman, at that point, I thought that it was a smart thing to do to ask what was my prognosis at that point. And he just kind of like gave us a textbook answer and said something like, when people have failed third line treatment, that it can be around 7 months. And so that's kind of, that left my husband reeling, right? I mean, it just, the emotions were almost like more there for him than for me. I think I was just kind of putting one foot in front of the other, just, doing what I needed to do. And like I said, my husband was the one who had to talk sense into me of even doing the treatment and everything. So, but that really hit him hard. And then just to hear him describe, how it felt when we were sitting in Dr. Strickler's office, my husband said that, relayed that onto him. And he said, no, he said, you've got a better chance of going down in a plane with me sitting next to you than, you not being here in 7 months. So that was really refreshing to hear.
That's just wonderful. And talk about having that open communication with your physician is just so important. So as you've been through the trial, have you had a lot of bad side effects?
For me personally, it has felt like I'm not even on treatment. It's been incredible. But, I think even the person on this particular trial who's having the most side effects, it's not as bad as standard treatment. And of course, they're only going to enroll someone on the trial who they think, can have success on it.
Right. And I think another one of the things that patients often worry about is that if they're on a trial, they might not be monitored as closely as if they were receiving, maybe immunotherapy or chemotherapy. What has your experience been with that since you've been on the trial?
I really have felt more monitored on the trial than I did before. Um, I don't remember exactly how often I was having scans before starting it, but I know that when I started the trial, we were doing scans every 9 weeks, and that was a little more often, I think, than I'd been getting them before. Um, and then we have since spaced it out to every 12 weeks, but that was something that I had full input into. Um, you know, they wouldn't have made that change if it wasn't something that I wanted to do. But I think that on any trial, your physician is going to be invested in how well you're doing and everything. So no, I mean, you get even more attention, I believe.
That's just a great point, Ellie. Um, so now you've been on the trial for how long?
It has been 3.5 years. I did eventually have recurrence near the primary site. I had never been eligible to have the primary tumor taken out um, prior to starting the trial. My CEA, which stands for carcinoembryonic antigen, that's a number that serves as an indicator, kind of like a tumor indicator for some people, like myself. That number plummeted from 22 to 25, or 2.5, sorry, in just the first few weeks of the trial, and continued to drop after that. But yeah, like I said, I had very little, practically zero side effects. I felt a little tired the day after each infusion every 3 weeks. But when I had the recurrent activity, Dr. Strickler consulted with radiation oncologist, Dr. Manisha Palta at Duke, and they together decided to advocate for surgery for me. She said because I was so young and otherwise healthy. So they said they were going to find me a surgeon who was willing to remove that primary tumor. And Dr. Julie Thacker at Duke is the first person we asked, and she agreed to operate. Then just this past January 2021, they noticed a small area in my liver that was becoming more pronounced with each scan. And I just had that removed. It's amazing to me how quickly they moved on that. I had scans. It was noted that, something, they were seeing something there. Then they had an MRI done, and I met with Dr. Zani, and we looked at the 2 prior CT scans and could see where it was kind of getting more pronounced each time. Once you know what you're looking for, it's easier to see. And so it was only about a centimeter, not much bigger than a centimeter lesion, but he scheduled me for surgery in 8 days after I met with him, and that's what I just had removed. So I mean, they're watching me like a hawk.
Yes, absolutely. And that's what I was going to say is that, because they are monitoring you so closely, they're able to see, like you said, something very small and get rid of it before it can turn into something that, we wouldn't want. So I think that's another testament to patients that may be fearful or, not really wanting to look at a trial, is that, you're just a perfect example of how they are watching you, they're monitoring you, and, they're on it the minute if something were to happen. So since then, you're back on the trial, you've resumed, and still minimal side effects and everything?
Yes, yeah, the side effects have never increased at all. And since they did act so fast, even that progression, didn't cause me to have to come off the trial.
We've touched on so many important topics, a couple of things in particular, the importance of a second opinion, the importance of being part of your care team, the importance of, excellent communication between your caregiver, like, you with your husband, and how important, not always easy, but to have that support system and find the people that are going to be there for you. Really, one of the most important things of our conversation was the importance of knowing your biomarker and having had those tests, because without that, you would never probably have started down this path. So
Yes. Yeah, absolutely. I was surprised when I would talk to other patients to hear that they hadn't had that testing done. Just because I assumed it was something that all oncologists would order, like like Dr. Tan did at Siteman for me, and found out that that is not the case, unfortunately. And so yeah, I have had to, tell people that you have to ask for it, and if your oncologist isn't willing to order it for you, find someone who will.
yes, absolutely, because it absolutely can be life-saving, and you're the perfect example of that. So yes, so very important. Well, again, Ellie, thank you so much for your time.
Thank you.
Thank you.